All right, I want to turn to disease prevention because I've already told you this is real important, but then the question is, what is it? What do we mean by disease prevention? Here's a definition. Anticipatory action, so action taken in advance to reduce the possibility of an event or a condition occurring or developing, or to minimize the damage that may result from the event or condition if it does occur. That's a lot of blather, a lot of words. Let's see if we can make some sense out of it schematically here. Primary prevention is the column that I'm pointing to right here. That's the kind of prevention we in public health love. That's big-time public health. What is it doing? It's dealing with people who are susceptible to a disease problem but don't have the problem at all. So it's, say, going to kids who could get obese if they don't exercise and watch their diets, and it's intervening with them to make sure that they avoid becoming obese and having the health problems associated with it. Down the line, there will be a reduced incidence of disease as a consequence. We love primary prevention. Primary prevention is the core, the heart of public health. There's another piece of it that we do. Oh, I should mention probably the single most important example of that is immunizations. People who are getting immunized against diseases don't have the diseases. You give them the immunization, they don't get the disease. So you're preventing it from occurring in the first place. It's wonderful because there are no adverse consequences. Now, obviously, with immunizations, there are very occasional adverse consequences. All right, there's another area, though, that we like, too. We like this a lot. I don't like it as much as primary, but we like secondary, too. Secondary is good. Secondary is taking people who are asymptomatic, and it is doing something by way of an intervention, typically screening and treatment, that will end up reducing the prevalence or consequence of their asymptomatic problem. What's a good example of that? Sir? Breast cancer screening, absolutely. Good. Other examples here? Yeah. Diabetes is a very good one. High blood pressure, high cholesterol, obesity. There are all kinds of things that we can screen for and do something about. Even though there's a problem there, you can avoid the problem down the line. First time I ever went to give blood, I was a senior in college, and I was probably nervous. I didn't feel like it, but I came out of there and they said, "Oh, you've got borderline high blood pressure." Now it turns out both of my parents have had high blood pressure throughout their lives, and lo and behold, I started getting treated for it. Now, one thing you can do, of course, is you can intervene by telling people to lose weight, to exercise, get themselves in better shape, and maybe their blood pressure will drop without giving them medication. But if that doesn't work, the next line of defense is medication. And when that happens, we have very good evidence that that will reduce the prevalence of strokes, heart disease, and other things down the line. Now, tertiary prevention means you're symptomatic. You've got a problem and you know it. And what we're going to do is we're going to intervene to try to reduce the complications and disability from that condition. This is what we commonly do in medical care and what we commonly refer to as treatment. Disease condition, something symptomatic that you come into the doctor about, and they say, we're going to do X, Y, and Z, and try to reduce the problems associated with it. So from a technical point of view, excuse me, we got primary, secondary, and tertiary. But in practice, public health is much more narrowly focused on primary and secondary. Tertiary is where we talk about services that are provided in the other health services. Yes, ma'am? STD treatment? Once again, this is interesting that so many of you are raising this. STD treatment would be something, it could be asymptomatic, it could be symptomatic. It depends. I mean, it depends where you are with the condition. If it's asymptomatic, you can get treated typically with an antibiotic and avoid the consequences of it. If it's already symptomatic, so something's happening to you, once again, treatment may be able to reduce the adverse consequences of it. Okay? What I thought was interesting when you mentioned STDs, that's another case of what we refer to as externalities, where a big part of the problem is not just you having it, but the fact that you're likely to spread the disease to others. and we'll be talking more about that.
Hi guys, my name is Mr. Sonnenberg. Today what we're going to be talking about is communicable and non-communicable diseases, meaning that diseases that can be passed on from one organism to another and diseases that cannot be passed on. So this is for Science 24 students, and this is Unit 3 that we're studying, and this is disease defense, and this will be topic 1 throughout the unit, and we've got a good unit planned for you guys. So first thing we need to talk about is what is a communicable disease. So disease is something that's caused by a microbe known as a pathogen, and we have another screencast that's going to actually discuss pathogens in more detail: viruses, bacteria and such, fungi, and so you can view that to better understand what's going on. But what a communicable disease is, it's meaning that we can spread from one organism to another. And there's a variety of ways we can do that. But if we take a look over here at some of the examples, we can see things such as the flu, the common cold, AIDS, SARS, and smallpox. And smallpox is actually the most lethal communicable disease known to in human history. And so, like I said, this is one thing that's passed on from one organism to another. But what we kind of look at here is SARS as well, and we're doing a little bit of a case study on SARS, which was an incident that occurred in Ontario, in Toronto, and this happened quite a few years back. But what happened was it was a communicable disease, so it was spread from one person to another. And we'll discuss throughout the screencasts how SARS is played, and then later in the unit we're actually going to look at some other communicable diseases and pathogens that were passed along, and maybe some epidemics or pandemics that have occurred, and you'll have to research that. So moving on. So communicable diseases, how do we spread, or how do they spread? What are the effects and symptoms and such that we can see? So we'll notice that there are 4 ways that we're going to discuss. So one right here, okay, is airborne. So basically you can spread through coughing and sneezing, and so we'll see it through our nose, kind of in our throat, and then in our lungs, okay? So some of the effects, you'll see a runny nose, you'll see a sore throat and a cough, so things like the cold and the flu, and then we can pass those on. Those are actually contagious, and they're communicable diseases. So the second thing we'll discuss is waterborne. So if we have contaminated water, then we can pass on these communicable diseases as well. And sometimes we'll have bacteria in there, maybe from feces, and we can contaminate that water system. And so examples of that might be things in the pool, and that's why they have chlorine in the pool, is so that they can kill all these diseases and these pathogens so that they don't spread throughout the various populations and such. The third thing we'll talk about is carried in food. So unsafe food handling. I know my parents are in the restaurant business and such, and food handling business, so constant sanitation, keeping things clean, utensils, countertops, making sure food is stored properly and also kept at the appropriate temperature so that bacteria don't grow, as we know that bacteria and pathogens actually will grow with increased temperature. But if we don't store these things properly and we don't use proper methods for preservation of that food, then what's going to happen is we can pass along these bacteria and such, and then we would call that communicable diseases. And then the last is just direct contact. So if there's an infected person and we have direct contact with that person, what can actually happen is we can pass that communicable disease on. Okay, so the keys here is communicable disease means that we can pass it from one organism to another. I sneeze in your face, cough all over you, then what's going to happen is you potentially could get, if I was ill or I was a host and carrying that pathogen or that disease or whatnot, or else that flu, the cold, whatnot, you could get that, and all of a sudden now you could become infected with that as well. So what I would do is I would pause the screencast at this point, and I would just take a look at this this chart and try to take a look at the various methods that these communicable diseases can spread, some common examples of each level at what type of bacteria that could be, and to see if you've ever heard of those things, and then also what are the effects if you come across these communicable diseases, And it might give you, maybe some of you have had these things before. I know I've definitely had a cold. I've definitely had the flu and things, but I've never had botulism or salmonella or anything like that. So you might have come across some of these as well. So moving on, again, communicable diseases. So we know that they can spread by air, water, food, and contact. So the question is, why are we not sick all the time? Why are we not always ill? So, and really what we do in our personal environment is we sanitize. We keep things clean, right? We make sure we're cleaning our home. We make sure we're cleaning our floors. We make sure that we're cleaning ourselves. And we're making sure that we're handling maybe food. Maybe we're making sure that when we cough into our sleeve and we're not coughing all over everything. And it's nothing worse. I remember I taught elementary my first year, and I remember I had this student that he would cough or sneeze, but he'd look you right in the eyes and he'd all over you, and all I'd say is thanks. And I've never been so sick in my life that year with those little kids coughing and their boogers everywhere, and oh, it was awful. I tried to get them to wash their hands so much, but they were coughing all over the place. But I tried to keep the environment clean so not everybody got sick, right? So just some examples. We can filter our drinking water, right? We're not going to drink right from a lake. That's not advised. We use things such as chlorine or antibacterial soaps. That kills the bacteria, right? And then also sometimes we wear gloves, or we use protective clothing. We use masks so that we can ensure that these communicable diseases are not passed on. Now, the process of communicable disease is what happens is we're going to get this mode of transmission, and we can pass transmission, meaning how we pass it on from one person to another. And so if I was to come in transmission from another person and those little students sneeze in my face, cough in my face, and I'm like, oh my God, are you kidding me? And it's all over me. And now what happens is now there's an entry. How is it going to enter my body? Is it going to go through my mouth? Am I going to inhale it? Is it going to be on my hands and then I'm going to touch my face? What's my mode of transition, and how is it going to enter my body? Once it's in my body, it's going to find a susceptible host, which means it's going to find a host and it's going to cling to that host, and then that infectious agent is going to build. And bacteria and viruses and such, they're going to build quite quickly. And then what it does is it develops a reservoir, which is kind of a big storage area for that disease. And then what's our route of exit? So now if I had the flu, I'm probably going to get some antibiotics. And what's going to happen is they're going to say, take these antibiotics, 1 pill or 2 pills, once or twice a day for 2 weeks. Now what's going to happen in that first week, I'm going to feel really good. It's going to go away. I'm going to say, I'm back. And what we have to be careful of is sometimes these pathogens and these bacteria and viruses can build resistance. And if they build that resistance, it's because maybe the antibiotic that was supposed to kill that pathogen or that communicable disease, it does so, but it doesn't kill all of it. And we also have mutations sometimes. But what's going to happen is if it doesn't kill all of it, they say take it for the full 2 weeks, even though you feel better. So if you take it for the full 2 weeks, then you're going to make sure you kill almost all of those infectious agents, and you're going to kill that whole reservoir, and then it's going to exit your body. Okay, so that is communicable disease. It's how we pass it on. So there's various methods like we discussed that are going to force us to pass it along. Now, communicable diseases are a little bit different though. Okay, so the key thing here is they're not caused by pathogens. And I apologize if you hear a buzzer in the background. I'm drying my clothes. I got to do laundry. So they're not caused by pathogens, meaning that they're not passed on from one organism to another. So the cause of a non-communicable disease, it could arise by 2 things. 1, genetic factors, okay, and then 2, environmental conditions, okay. So maybe where you live or things that you're exposed to and such might actually cause these particular diseases, but they're not passed on. So if I cough in your face, that's not a non-communicable disease. That is communicable. Non-communicable is maybe genetically it just occurs within you, and you can get this disease. So how does the non-communicable, or how do you get a non-communicable disease? I'm struggling with that word, I'm sorry. Non-communicable disease. Now, these are usually a result of bad environmental conditions. So things like poor diets. How would I get diabetes? Well, maybe due to obesity, inactivity, poor diet, and such. Unhealthy lifestyles. Okay, so that's ways that we can get these. Also, genetics play a role in developing those non-communicable diseases. So those are your traits. Those are the genes that are passed on through generation within your pedigree, within your family. Okay, and so sometimes we have hereditary traits that are passed on that can cause particular disease. Okay, so we'll learn more about that as we move through the unit as well. And then not all microbes, though, make us sick. So not all pathogens or microbes, these tiny microorganisms, not all of them make us sick. So really our body is covered in a sea of microbes, but there's both pathogens that make us sick, and then there's also good microbes, okay? And those are the ones that maybe protect us. And we don't know as much about them as we do about the pathogens.
Drop-in lessons for adolescents and teens.
Infection control, preventing the spread of germs. Wash your hands.
Hand washing is the single most important thing you can do to prevent the spread of germs. When done correctly, hand washing removes most germs from the skin. This is what you need to do. Wash your hands often with soap and warm water. Scrub for at least 20 seconds, being sure to get in between the fingers and under the fingernails. Dry your hands thoroughly. Use alcohol-based hand sanitizer when soap and water are unavailable.
Cover your cough and sneeze.
Cover coughs and sneezes with tissue and get rid of the tissue in a wastebasket. If you don't have a tissue, cough or sneeze into your upper sleeve or the crook of your arm, not into your hands. Then wash your hands after coughing or sneezing.
Keep hands away from face.
Germs can enter your body through your eyes, nose, and mouth, so as much as possible, keep your hands away from your eyes, nose, and mouth to prevent germs from entering your body.
Stay home.
If you are sick, stay home. Staying home prevents the spread of germs to others at school, work, or other places like sports or band practice. If family members are sick, tell them they should stay home.
Vaccinate.
Medicines are used to treat or cure diseases. Vaccines prevent them. Vaccines have saved millions of lives and prevented the spread of many dangerous infectious diseases. Vaccines are safe and effective. They work by stimulating the immune system. Vaccines contain the same antigens or parts of antigens that cause diseases. Vaccination primes the immune system to remember a particular antigen or disease agent by allowing it to practice on a weakened or dead version of the germ. If the germ enters the body again at full strength, the immune system is ready with a swift and specific defense. Vaccines are available for many diseases, including chickenpox, influenza, measles, polio, smallpox, typhoid, whooping cough, and others.
Herd immunity.
When a contagious disease enters an unvaccinated group of people, many are infected because they don't have immunity to the disease. When a large percentage of the population is vaccinated, the spread of disease within a group of people is limited. This indirectly protects those who have not been vaccinated. This is called herd immunity. For some diseases, herd immunity may take effect with as little as 40% of the population vaccinated. However, vaccination rates usually need to be as high as 80 or 95% to achieve herd immunity. This percentage is called the herd immunity threshold.
Community strategies.
Social distancing helps prevent the spread of disease by limiting direct contact between people in work, community, and school settings. Social distancing can be as simple as staying at least 6 feet away from others when being out in the public. It can mean working from home instead of going into the office. Isolation and quarantine are public health practices to stop or limit the spread of disease. Isolation is the separation of a person or group of people from other people to limit the spread of disease. Isolation applies to those who are diagnosed with or suspected of having a communicable disease. It's a standard public health practice to control disease and can be legally enforced. Quarantine means restricting the activities or travel of healthy people who have been exposed to a communicable disease. Quarantines can be effective for controlling some contagious diseases, but they are very hard to carry out. As a result, they are only used in emergency situations.
Summary.
Infection control means preventing the spread of disease. Many different strategies are needed. Hand washing is one of the most important personal strategies.
Diseases caused in children and their prevention. Let us have a look at diseases children suffer from and what can be done to prevent them. Some diseases that spread through air are common cold, whooping cough, influenza, diphtheria, measles, tuberculosis, and pneumonia. When a sick person coughs or sneezes, the disease-causing germs from his body spread into the air. When a healthy person inhales the contaminated air, he also falls ill. Let us have a look at common cold, which you must have suffered from at least once. Common cold is caused by a virus. The symptoms of common cold are a running nose, mild fever, watery eyes, a headache, body ache, and a sore throat. To prevent catching a cold, avoid contact with infected people. The infected person should cover his nose and mouth while sneezing or coughing. Let us look at whooping cough. Whooping cough is a bacterial disease often seen in children. The symptoms are brassy cough, vomiting, and watery eyes. Whooping cough can be prevented by vaccination. Pneumonia is a serious infection of the lungs. The symptoms are severe chills, high fever, rapid breathing, cough, vomiting, and chest pain. Heavy doses of antibiotics are required for its treatment. Now let us have a look at influenza, which is also called flu. The symptoms are high fever, body ache, and dry cough. One must avoid contact with a person suffering from flu. Measles is another contagious disease. The symptoms are red rashes, running nose, high fever, and cough. An MMR vaccine can prevent measles. Let us have a look at diphtheria and its symptoms and preventive measures. When an infected person coughs or sneezes, the bacteria is released into the air. The symptoms are mild fever, sore throat, and swollen glands. A DPT vaccine is given to children to protect them against this disease. What about diseases which are non-communicable? Diseases like allergies, asthma, silicosis, and asbestosis. How can we prevent the above diseases and what are their symptoms? Let's find out. These diseases are caused when our body has an unfavorable reaction to certain substances, also called allergens. The unfavorable reaction, which can also be called the symptom, includes rash, boils, sneezing, and swelling. Asthma is an allergic reaction to an allergen. The windpipe swells and the air passage narrows. The patient experiences difficulty in breathing. Allergies can be prevented by keeping the house dust-free, covering the nose when there is dust in the atmosphere, keeping a list of things that can cause allergies, avoiding allergens like pollen, dust, animal fur, and even strong smells. Let us do a quick recap. The symptoms of common cold are a running nose, mild fever, watery eyes, headache, body ache, and sore throat. It can be prevented by avoiding contact with infected people. The symptoms for whooping cough are brassy cough, vomiting, and watery eyes. It can be prevented through vaccination. The symptoms of influenza are high fever, body ache, and dry cough. It can be prevented by avoiding contact with infected individuals. The symptoms of measles are rash, running nose, fever, cough. The prevention is the MMR vaccine. The symptoms of diphtheria are fever, sore throat, and swollen glands. The DPT vaccine helps prevent diphtheria. The symptoms of allergies are rash, boils, sneezing, and swelling. The preventive measure is to avoid allergens. The symptoms of pneumonia are chills, fever, rapid breathing, cough, vomiting, and chest pain. High dose of antibiotics can help prevent pneumonia.
Dengue is a disease caused by a virus that is transmitted to people through the bite of the female Aedes mosquitoes. The important species are Aedes aegypti and Aedes albopictus. The symptoms of this disease may be similar to those of the flu and include high fever, headache, red spots on the skin, and extreme tiredness. Bleeding from the nose and gums may also occur. In the presence of these symptoms, you should not take any medication containing ibuprofen or aspirin, since these medications can increase the chance of hemorrhage. You need to go immediately to the nearest medical center. To prevent the infection, you should avoid being bitten by the dengue mosquito. The mosquito bites mainly in the morning and shortly before dark. It lives no more than 100 yards away from where it was hatched. They usually hide in dark areas behind plants and shrubs. Indoors, they can hide under beds, behind curtains, or in the bathrooms. At home, you can be protected by placing metal or plastic screens in doors and windows. Keep doors and windows closed. Install bed nets around the beds and sleeping areas, following correct instructions. You can also use battery or electric diffusers with pads impregnated with insecticides and insecticide sprays. When performing tasks outside your house, you can protect yourself by wearing socks, long pants, and long-sleeve shirts, preferably light-colored. You can also apply repellents on exposed areas on your skin. Environmental sanitation around the home is more effective when performed together with our neighbors and the community. Environmental sanitation may consist of 1. avoiding the accumulation of stagnant water around homes where mosquitoes can breed. 2. Removing car tires that are not in use. 3. Picking up trash and placing it in bags or in tightly closed containers until a collection service can take it away. If this service is not available, you can also burn or bury the trash. 4. Removing empty bottles and other containers that can hold water, or placing them face down so they do not hold water. 5. Changing the water in bird baths and flower pots on a regular basis. 6. Cleaning roof gutters that may serve as water reservoirs. 7. Placing sand under potted plants. 8. Applying chlorine in swimming pools to prevent mosquitoes from laying eggs. 9. Ensuring that clean water tanks for human consumption are tightly closed. 10. Mowing lawns regularly. Let's all work together to stop the spread of dengue.
According to the American Lung Association, pneumonia kills 40,000 to 70,000 Americans each year. More than 1 million Americans are hospitalized every year from pneumonia, making it the third most frequent reason for hospitalization next to births and heart disease. For recurrent pneumonia patients, it is important to recognize the symptoms: coughing, chest pain, difficulty breathing, high fever, and nausea. Early detection by your doctor can help prevent severe cases. Your diagnosis will begin with a brief medical history. It is important to be thorough, including past family history, smoking, hospitalization, and surgical history. A physical examination will help to understand abnormal lung activity identified by bubbling, crackling, or rumbling sounds. Chest X-rays can confirm the presence of pneumonia in the lower lobes of the lungs. Air is black while pneumonia appears as white clouds. Proper diet is important to prevent malnutrition during the recovery process. Be sure you are getting a high-calorie, high-protein diet. Vitamins and minerals to strengthen your immune system, fruits and vegetables, as well as 1.5 to 2 liters of fluids daily. Activity is also important for preventing pneumonia. Walking 15 minutes per day or as tolerated can help condition your lungs. Another way to condition your lungs is to use the incentive spirometer. The medical device is very effective, but proper technique is the key. The first reaction for most patients is to blow into the spirometer, but this is improper technique. The proper use of the incentive spirometer is to first seal your lips tightly around the mouthpiece. Next, draw your breath in slowly and deeply. Note your highest level. Finally, hold your breath for at least 3 seconds and exhale normally. Repeat this exercise 5 to 10 times and follow with a deep cough. This mobilizes secretions and fully expands the lungs. Preventing recurrent pneumonia is equally as important as treatment. Avoid smoking. Be sure to receive flu and pneumonia shots as advised by your doctor. Avoid people with a cold or the flu. and follow proper hand washing steps. Apply soap to your hands under running water. Rub your hands together to create a lather for 20 seconds. Rinse your hands well and use a clean towel or air to dry.
TB is an infectious and contagious disease caused by a bacterium called Mycobacterium tuberculosis. TB represents a truly global threat. Up to 1/3 of the world population may be infected with or has been exposed to tuberculosis. Anyone can be exposed to or get TB. This disease is transmitted or spread from person to person through droplets of saliva or mucus expelled during a sneeze, coughing, shouting, or singing, as this may contain the TB bacteria if the person has the disease in its active stage. If a healthy person breathes in these droplets, the mycobacteria can lodge in the lungs. It can also migrate via the bloodstream and affect other organs, such as the skin, kidneys, spine, meninges, or the urinary system. TB is not spread through contact with personal items, clothing, or through shaking hands. People most susceptible or at greater risk of contracting the disease are people with weakened immune system, patients with HIV/AIDS or diabetes, smokers, the elderly, patients with organ transplantation, and alcohol and drug users. An additional risk factor may be presented when people are exposed to frequent, prolonged, and close contact with the persons who have active TB. The first symptoms of active tuberculosis are poor appetite, weight loss, cough that may be accompanied by bloody sputum, variable fever, night sweat, chest pain, and fatigue. If you or someone you know has any of these symptoms, or if you have been in contact with someone who shows the above-mentioned symptoms, it is important to talk to your doctor or go to your nearest medical facility. TB can be diagnosed with a simple skin test known as the Mantoux reaction, or tuberculin test. A series of tests that may include a chest radiograph and samples of blood and sputum can be used to determine TB infection as well. TB is treatable and curable. Once diagnosed, it can be addressed through a series of specific antibiotics. Talk to your doctor when planning your treatment. It needs to start quickly to increase your chances of overcoming TB. Make sure you understand their instructions and get answers to your questions. Treatment can last several months. It is very important to follow it strictly. Even if you feel better, it is no reason to stop your treatment. You must complete it as indicated by your doctor. Failure to comply with treatment as indicated can cause the mycobacteria to become resistant to antibiotics. This can make TB more aggressive and dangerous, a condition known as drug-resistant tuberculosis. To prevent the spread of infection, maintain good nutrition and drink a lot of fluid to stay well hydrated. Attend regular health checkups with all family members. Avoid staying for a long period of time in a crowded place. Avoid drugs, alcohol, and cigarettes. When you cough or sneeze, cover your mouth and nose with a tissue or your arm. Also, use a face mask when possible. Let's all take these preventative measures to stop the spread of TB.
Hi, I'm Dr. Willie Ong. For this video, I would like to teach you about type 2 diabetes or diabetes in adults. The problem with diabetes is that the body's pancreas does not produce enough insulin, and insulin is a hormone that helps in the entry of sugar into the body cells. Another problem with diabetes is that the cells may be resistant to the effects of insulin. Therefore, in diabetes, sugar or glucose accumulates in the blood, and this is the one that causes the symptoms and complications of diabetes. Now, some patients, they don't have any symptoms because diabetes occurs gradually. But other patients, they can have dry mouth, and when the blood sugars rise, the cells becomes dehydrated. So patients may have dry mouth, they may drink more water, they may urinate more often. Another symptom of diabetes is eating more food and yet not gaining weight because the food and the glucose are not absorbed by the body. And diabetics, they may feel tired or there may be poor healing of wounds. The best way to find out if you have diabetes or not is to check your fasting blood sugar. And we have to look at the levels. If it is 126 milligrams per DL or higher, then that means you probably have diabetes. If it's a little lower than that, then you can have pre-diabetes or an early form of diabetes. Now, in other countries, they use a different unit. We have to remember the cutoff value. If it's 7 millimoles per liter or higher, then you probably have diabetes. You have to check it twice to be sure. Okay. Now, for those with uncontrolled diabetes, we have to monitor you for complications. We have to check for heart disease, and we have to watch out for stroke because high blood sugar, it can damage the blood vessels. Okay. Other complications are nerve problems, foot injury, eye disease like cataracts, kidney disease, and gum disease. And because of these potential complications, doctors have to regularly check you up. You have to regularly monitor the brain, the heart, the kidney. You have to check your eyes every year and have a dental checkup every 6 months. Okay? But the best tip of all to prevent all these complications is to control your blood sugar. And you can do this in 4 ways. Number 1, healthy diet, low in sugar, low in fat. Number 2, exercise regularly, move about. Number 3, monitor your blood sugar regularly. It has to be in normal or near normal levels. I showed you the levels already. And number 4, you have to see your doctor regularly because you may need to take some medications. To learn more about a healthy diet, you can check out my other videos on weight loss, cholesterol, and preventing heart disease. If you follow my other tips, then you will also be preventing diabetes complications. I hope this short video will help you take diabetes as a disease seriously. Good luck and take care.
Welcome back to Fast Forward. Today we're in Atlanta, Georgia, visiting the Centers for Disease Control and Prevention, aka the CDC. What's the CDC, you ask?
CDC is the nation's public health agency. We're charged with helping to prevent illness and keep the population healthy.
We are responding to reports of disease outbreaks. We may go out in the field and help investigate what's happening and how to stop it.
We employ about 15,000 people all over the world. Here in Atlanta, which is our main campus, we have 5,800 people, and we're the 20th largest employer in the state of Georgia. The CDC's 24/7 mission is to save lives and protect people.
Another way of looking at it is that the CDC is one of the best sources on the planet to answer any health-related questions you might have. So let's start asking. What's up with the giant mosquito from the top of the video?
If you think about the problem of malaria, it is like one big giant mosquito in essence, because the mosquito is the big challenge and transmitter of the malaria parasite, Plasmodium, that gets passed to us when they bite us. Malaria is an incredibly important disease. In fact, CDC, when it first started in the 1940s, was started to fight malaria. So it is like one big mosquito problem.
Okay, I'm thinking it'll help to learn a few terms for this video, so let's get started.
Epidemiology.
Epidemiology is the study of diseases and how they spread, but Jeanette has a more creative way of looking at it.
Epidemiology is disease detectives. It's looking at an outbreak that you have. You know, it could be of food poisoning, it could be of HIV or AIDS, and trying to find a source. So going back and trying to find a common root for all of those diseases and seeing if you can link it to a single source. Like with salmonella, sometimes you get salmonella outbreaks and you can link it back to like infected tomatoes or spinach or something. That's epidemiology. It's like a crime show, but with disease.
That's a good analogy.
Somewhat like CSI, except it doesn't all happen in an hour. Usually it takes
and we're not pretty like
CSI. Nice. And wouldn't it be great if the CDC had some sort of program where teenagers could get a chance to try this themselves? Say no more.
So here at CDC, we have a program in the summer called Disease Detective Camp.
It gets high schoolers into the CDC and they get to take tours of some of the facilities and they meet CDC staff people.
They can actually participate in experiments and it gives them an opportunity to get interested more in what goes on behind the scenes.
At the end of it, they do what they call the disease detectives, and they're given a scenario where there's some disease and they've got to interview people and find out the symptoms and figure out what the disease is. And it's really, really cool, and it gets high schoolers engaged in public health.
That's some serious on-the-job training. Okay, let's get to another term you hear a lot at the CDC.
Mutation.
A mutation is a genetic alteration in the DNA of a bacteria, virus, or fungi.
And it can also be found in plant and animal cells. And mutation plays a big part in something called the evolution of antibiotic resistance. And it relates to how antibiotics fight infections in your body when you're sick. I'll let Stephanie, a CDC public health analyst, tell you more about that.
I know that I've been tempted at times. I feel better and I don't want to finish taking my medication or finish taking my antibiotics. You get the strongest of the strong that are still living if you don't finish your antibiotics.
What this means is that if an antibiotic kills some bacteria but leaves more resistant bacteria alive, the population will evolve as the resistant bacteria reproduce and become the majority. So the CDC is at the forefront of science. But Jeanette knows something about this place that just might surprise you.
The great thing about the CDC is that you don't have to be a scientist to work here.
Really? Keep talking.
I didn't like math in high school, but I did like science, but maybe not enough to major in it in college. But I liked English, so now I can come here and communicate about science.
You know, we have security personnel, we have technology folks, we have public health people, we have healthcare workers.
You can do other things like graphic design, communications, education, materials, brochures, posters. My gosh, you can do laboratory if you want to, and you can do travel or you can stay local.
We all work as a team, and I think that that's one of the things that makes CDC such a cool place to work.
The big field now is bioinformatics. It's looking at huge amounts of data and processing that, and that's a lot of computer background, writing computer codes, and that technology is moving so fast, and we interact with those on a daily basis.
Cool jobs. So what kind of people do you hire?
If you're trying to work at CDC, I think the first thing that you should do is have a passion for public health.
So I think that's kind of the glue, bringing together many different professionals and training backgrounds here at CDC. People want to make the health of our nation better and go beyond our borders to working with other countries to try and make it a healthier planet.
Okay, just in case there's any doubt about the kind of folks who work here, I want to finish with a story about an amazing day Jennifer had with the CDC.
So the coolest thing I ever did as part of my job was actually on September 11th, 2001. We were both here at work that day when the planes hit the World Trade Center towers, and they had turned the TV on in the CDC lobby, and we were looking up and we were thinking to ourselves, oh my gosh, I want to help. How can I help? And CDC was one of the few agencies that had a way to help. And so they were actually going to send a team into New York City that day on September 11th. And I raised my hand and volunteered to go. So I was on the Learjet, the CDC Learjet that flew into Manhattan that day with a fighter jet escort. And we set up surveillance in the hospitals in New York City. So that was a pretty intense time, but it was probably one of the things I'm most proud of at CDC.